What is a subchorionic hematoma, and does it mean that you're at risk for miscarriage? I'm Dr. Ali. I'm an OBGYN. I personally had a subchorionic hematoma with my pregnancy, and here's my baby girl. A subchorionic hematoma, which is the same thing as a subchorionic hemorrhage or an SCH. It's bleeding that occurs from the detachment of the chorion. This is the fetal side of the placenta. The chorion starts to detach from the uterus. This can lead to an accumulation of blood between the wall of the uterus and the placenta. And we're able to see this on ultrasound. What are the symptoms of a subchorionic hematoma? This is going to be the most common cause of first trimester bleeding. It can be light spotting, or it can be heavy bleeding. It can also come with a little bit of cramping. What's crazy is that some people may not have any symptoms at all. I personally didn't have any symptoms, but I saw my own subchorionic hematoma on ultrasound. What is the association with miscarriage and a subchorionic hematoma? Now, they are associated with an increased risk of miscarriage. This is especially true if the area that's identified on ultrasound, that's the hematoma, is greater than 25%. It's also been shown that the location of the hematoma can also increase this risk. The worst outcomes are when the hematoma is directly behind the placenta as opposed to on the margin, like on the outer part. If you're told you have a subchorionic hematoma, what is your prognosis? Good thing is that most subchorionic hematomas actually resolve on their own without having to do anything. And most go on to deliver a perfectly normal, healthy, beautiful baby. Now, for some patients, the hematoma may continue to grow and expand, but this is definitely much more rare. Also, why, if there is a subchorionic hematoma, a lot of the times we'll just follow these patients with ultrasounds, especially like more frequently than we normally would. Keep in mind that just because you had bleeding in your first trimester does not mean that you have a subchorionic hematoma. We have to be able to identify that on ultrasound first. Remember, most importantly, because you have a subchorionic hematoma, the chance of miscarriage is very low, and most women go on to deliver full-term healthy babies like I did. If this is something that you're currently struggling with, you just got this diagnosis, you're scared, you're nervous, I'm here to reassure you. I hope this information helps, gives you a better understanding. Obviously, if you have more questions, I encourage you to reach out to your doctor, maybe schedule a follow-up ultrasound, or ask more questions so that you can find out more information about your hematoma specifically. As always, my goal with these videos is to educate and empower so that you have a better understanding about your pregnancy and your health. Take care. Love you guys. Bye.